Hello everyone, my name is Butu and I'm a student at Hartland College. For today's chapel talk, we are going to have Dr. Emerson being the presenter. Dr. David Emerson is a physician at the Lifestyle Center here in Hartland. He's going to be presenting today on how we can treat both bacterial and viral infections using hyperthermia. It has also been shown that hyperthermia, which is the use of hot water, can also be used to actually cure cancers. This is basically done by boosting one's immune system. And so I pray and hope that you will all be blessed.
Okay, well, so fevers, we found that fevers can be helpful to fight bacteria and fight viruses. Can they help with cancers? Fever therapy has had some success as an anti-tumor agent, according to articles as far back as 1967. They started to see a correlation between higher temperatures and cancer regressions. One of the more striking examples was William Cooley, Dr. Cooley. He was an orthopedic surgeon, a bone doctor at the Memorial Sloan Kettering Cancer Center. Was the leading surgeon of his time. He lived from 1890 to 1936. But early in his career, Dr. Cooley noticed the spontaneous remission of a large, they called a lymphosarcoma. It was in the head and neck. And what had happened was the patient had this tumor. They really couldn't treat it. But then the patient got an infection, a streptococcal-induced erysipelas infection. And then the body mounted an immune response to the infection. Once the infection was cleared, the immune system went on to clear the cancer, and the cancer went away. Interestingly, I did talk to a surgeon in Oklahoma who did a lot of breast cancer surgeries, and he said, yeah, there's actually an article that said when you do breast cancer surgery and you take a tumor out or lumpectomy, that the recurrence rate actually drops. The patients do much better if they get a postoperative infection. He says, now, don't let them get the infection, no, because that would be considered bad practice. But he said they know that when they do get an infection, they do better because it stimulates the immune system to fight the cancer. Well, once Dr. Cooley saw that this had happened with his patient getting an infection, he then got some Streptococcus pyogenes, one of the common infectious agents. He kind of killed it, so to speak, and then he injected the remains of it into people with cancer. And what happened was the body mounted an immune response to the infection, and then that immune response helped fight the cancer. It wasn't 100% successful. He had a cure rate of about 10%, which was unheard of even at that time. That was a very good response, getting 10% of your patients to respond. He was actually now considered the father of immunotherapy today because of his early work with the immune system. It seems that having a fever in childhood actually exercises your immune system, so to speak. There's evidence for this, that having fevers as childhood can actually help you avoid cancers later on in life. 1934, 1935, Dr. Engel observed findings that when he compared 300 patients that developed cancer and 300 patients that never got cancer, when he looked at their history of those that had experienced fever as a child and those that had never had fevers as a child, he found that if you never had a fever as a child, they had 2.5 to 46 times more likely to develop cancer later on in life. 1936, Cynic reported similar results comparing 232 cancer patients with 2,444 controls. They have also looked at what they call spontaneous remissions. In other words, patients who had cancers that would have been considered terminal, they really couldn't treat, but for some reason the tumors went away. These were called spontaneous remissions. And when they looked at them closely, they found that for leukemia, blood cancer, over 22% of the ones that went away had had a fever previous to its going away. Cancers of the bone and connective tissue, over 15% of those were associated with a fever prior to the remission. 11% of the melanoma cases and over 7% of the lymphoma cases also were preceded by a fever. Now, there's a fever being associated with turning on the immune system and a remission of the cancer. How does fever help fight cancers? Well, we believe that the main effect of fever is, again, to turn on the immune system, as we discussed yesterday. Well, if there is an effect of fever with cancer remissions, is fever being used today? Yes and no. It is actually used in Germany as a standalone treatment for cancer. I actually got to see this. It was this interesting story. We had a fellow who had been, he got mixed up with this drugs, and as a young person, and but he got over it, became a Christian, gave his heart to the Lord, and became a very zealous witnesser. He would go into Walmart with a spiritual DVD, and he had a way of getting a spiritual conversation with the person he was talking to. He would go up to he would always start with a question, like Jesus did. He would ask the woman at the well questions, and that tends to open things up rather than coming across with a statement. So he'd go up to someone who's looking at the DVDs. He'd say, "See any good DVDs lately?" And the guy said, "Nah, they're all junk." And he says, "Well, I feel impressed. You'd really like this one." And then he would give him a DVD on a spiritual topic. We actually let him stay in a little mother-in-law house behind our house in Oklahoma for about 8 years. And we didn't charge him anything, and we really didn't think anything of it. Well, we moved, and eventually sold the house, and we didn't hear from him for about a year or two. And then I get a call from him a couple of years later. Turns out he had married this really nice Chinese businesswoman who was a multimillionaire, but she had breast cancer, and she wanted to get it treated over in Germany. So he said, "Dave, I want you to see what's going on over there, so I'll pay your way over." So he paid my way over to see what was happening in Germany. So it pays to be nice to people. We got to see what they were doing. And in Germany, they had this light box. A person would lie prone in it. They'd have heat lamps on them. They'd raise the temperature up to 102, 104. And as soon as they got up to there, they would shut the lights off, wrap them in blankets, and monitor them. The box is about a $20,000 box, but they measured your rectal temperatures, your blood pressures, your heart rates, and all these. And they were also doing intravenous vitamin C and other things. And one of the ladies there was from Pennsylvania. She actually flown over from Pennsylvania. She had a cancer associated with the pleura outside the cancer. It caused pain when she took a deep breath. She'd been there for several weeks. Her pain was gone. She was doing very well. And but she was angry. And I said, "Why are you so upset?" Well, what she was upset about was, she says, "Why do I have to go to Germany to get this treatment? Why can't I get this in the United States?" Actually, Germany has in their constitution a freedom of, like we have freedom of religion, they have freedom of medical care. It's guaranteed them that they can do these alternative approaches. However, we don't hear much about it here in the United States. We do hear limited things. For instance, in the United States, they are doing hyperthermia in a limited fashion. They do local heating, and what it's done is they will add it to chemotherapy. They won't do it by itself, but when they add it to chemotherapy, it is more effective. It helps chemotherapy invade the tumor more effectively, and but it also, again, turns on the immune system. It's like giving a local hyperthermia treatment. They have used this in well, they've done studies, 8 to 10 randomized studies show that there's an improved response when they treat, say, a head and neck tumor with radiation and they add this local heating to it. It improves the response in head and neck tumors, glioblastomas, melanomas, and locally advanced cervical cancer and local recurrences of breast cancer and esophageal cancer. And they do this in Germany as well. How do they do it? How do they heat it up locally? They actually use this BSD machine. It's an MRI machine. The patient goes through it. The MRI localizes the tumor, and then they have an array of microwaves, which, just like you use a microwave to heat your food up, they use these microwaves to heat the tumor up locally. The MRI can actually tell how hot they're getting the tumor, and they will heat it up locally, and they will get a response with that. This is Dr. Peter Wust in Charité Hospital in Germany, and he says it does improve responses. In China, they are doing this a lot, and they do a lot of the research in China with these BSD units, and they're getting dramatic improvements. For instance, in China, they had 60 patients with non-small cell lung cancer. They gave chemotherapy, and in some of the patients, they added the hyperthermia. Others, they did not. When they add hyperthermia, the complete response rate goes from 37% to 63%. It's about a doubling of the response rate, a dramatic increase. Partial response was increased from 40% to 77%. Stage 4 head and neck cancers, that's where it's metastasized everywhere. When they add hyperthermia to radiation, they had improved tumor disappearance, went from 41% to 83%, dramatic increase in response. Improved local relapse-free survival, went from 24% to 68%. And it improved 5-year survival. That's, you wait 5 years and you count how many people are still alive, from 0% to 53%. Again, a very dramatic increase in survival just by heating the tumor up locally. It was halted. Well, they cut it short, the study short, because of ethical reasons, because they couldn't withhold it from people when they saw that they were getting such good response. What is this doing? Pancreatic cancer, very lethal cancer, progresses quickly. Verona study showed that when you add hyperthermia to chemotherapy, survival, 24-month survival goes from 19% to 36%. Normally you do 5-year survivals, but in pancreatic cancer, they have so few people surviving 5 years, they do 24-month survival rates. Well, the survival rate for 24 months went from 19% to 36%, about essentially a doubling of it. And they've done other studies to show similar improvements. Because of these good responses with this BSD unit, Cancer Treatment Centers of America, nationally known for treating cancers, are using this now in addition to their other approaches. Is whole body hyperthermia being used in the United States? It is being used, or it was being used in University of Texas, Houston, as a sort of in research. They would anesthetize the patient, put heating blankets over them, and bring the temperature up that way, and they would get temperatures about 104 degrees for about 6 hours or so as an adjunct, again, to chemotherapy. And that's them using it. These units are complicated, and they typically cost a lot of money to get the machines to do that. But we're able to actually do hyperthermia in bathtubs, Lifestyle Center. The first time I used hyperthermia was actually my wife had breast cancer. It was locally advanced. Well, it was already involving her lymph nodes. He did a lumpectomy initially, but there was surrounding tissue was still involved with. They didn't get it all, and it was involved in the axillary nodes. And we, at that point, she had tried a lot of different modalities prior to that. But after they did the initial surgery, we did hyperthermia. We just used our bathtub and got water. You get water to about 110 to 112, and you put them in the bathtub. You raise the temperature up try to get it up to 102. Actually, ideally, it's about 104. She was a real go-getter. She wanted to get up to, she got up to 106, I think, and she did it once a week. It is very exhausting because when your temperature is elevated, your heart rate, your metabolism is racing, and so it can be exhausting. We usually monitor their oxygen saturation with the pulse oximeter. Oxygen saturation can drop. We try to keep it above 90. Sometimes you need a nasal cannula to do that. If you don't have a nasal cannula, if you have someone who is not real active physically, not exercising, they can get delirious. They'll start confessing their sins. And I think, really, you think, well, that's strange, but that happened to my wife. She started confessing her sins. And it was like, it's like you're getting ready to die when your oxygen saturation goes. And when I first heard a report of this, I said, no, come on, really? And yeah, no, it's real. It's very real. On the other hand, if you get somebody who is a runner, who exercises a lot, her friend actually had similar breast cancer, and she ran every day. And when she got in that hot fever bath, she said, "Oh, this is nice," and she just started reading a book. So your exercise condition can make a difference in how you handle these treatments. And after 6 weeks, we did about once a week for my wife, and she went back, had more surgery. But when they looked at the lymph nodes, it was clear. There was no further involvement in the lymph nodes, and the cancer in the main breast had gone from invasive to in situ. It had regressed. So it is powerful, and it can be very, very helpful. And that's what we're doing at Lifestyle Center for patients. We also do intravenous vitamin C. We do ozone. We do juicing. Gerson therapy has been doing that for 80 years or so and getting good response. We'll do the teas, the herbal teas, Easiac teas, which have had good track records. And of course, a vegetarian diet, avoiding the animal proteins, which was documented to be very helpful in the China study. And so that's pretty much the program. So if you have people that have cancers, you can give them some advice. We can tell them what to do at home. Most of the things that we do here can be done at home. We like to train people so they can continue to do them at home when they leave here. Other patients, you tell them what to do and it's just overwhelming. Those patients need to come to a center where it's done for them and they get trained into it. However, there's some that are very, on the ball, and you just tell them what to do and they go home and they do it. So we try to help both classes of people. So thanks for coming.